In the 1970s, the federal government got the notion that if you limit the number of medical facilities, you would somehow control costs by making sure there is not overcapacity in the system. Within a decade or so, they realized that this was an experiment that had failed. Certificate of need laws did not control costs, and instead what they did was they limited competition. That actually had the effect of driving up costs and lowering quality and restricting the access to medical care. Existing medical providers in these states realized that the certificate of need laws were a very effective means of preventing competition for moving in, because what the con laws require is that you get the state's permission to open a new treatment facility. And what we see in state after state after state is whenever a company comes in and tries to open a new facility, the existing providers are the ones that invoke the certificate of need process to fight it. In many cases delaying it for years, and in many cases just killing it altogether. The situation in Iowa was particularly stark because just a few years before, the existing providers in the area had issued a report saying that there was a desperate need for inpatient mental health facilities in the area. And yet when this private company came in and wanted to build its own mental health hospital, those same existing providers insisted there was no problem. And if there was a problem, they were the ones to fix it. Even though the state delayed the approval of this new inpatient mental hospital for more than 2 years, that didn't make the need go away. What we saw was local sheriffs and police saying, just because we don't have a place to take these people who need mental health treatment doesn't mean that that need goes away. What happens is these people wind up in our jails, they wind up getting arrested, they wind up in hospital emergency rooms, they wind up in the streets. They still have the need, they just don't have the ability to get treatment. And it's not because they don't want treatment, it's not because people don't want to help them, it's because the certificate of need laws have been used to prevent facilities that are so badly needed in the area. When you hear from other mental health providers that there just simply are no options for people who are having severe mental health breakdowns, when you hear all of that on one side, and then you look at the fact that it took 2 years, more than 2 years, for this state agency to conclude, yeah, maybe there is a need in Iowa, that just tells you that the process is no longer about need, it's about politics. By limiting to access to care, you're not controlling the cost. All you're doing is controlling the competition. When there is no competition, you have no place else to turn.